Hypochondria. When worry turns into a symptom itself. We all worry about our health sometimes. Maybe you feel a small pain in your chest and briefly wonder, is it my heart? Or you can get a headache and think, is it a migraine? That is normal. But in some people, this kind of worry becomes persistent and overwhelming. They start to believe that some small harmless body sensation might be a sign of a serious illness. That constant fear and checking, despite normal test results and reassurances, is what doctors call hypochondria, or more formally, hypochondriasis. It is not imaginary illness. The person really feels the symptoms, but the cause is not a disease in the body, it is anxiety about disease. So, it is not just about body or about the mind, it is psychosomatic. What is hypochondriasis? Hypochondriasis is a psychological condition where a person becomes preoccupied with the belief that they have or they are developing a serious illness, even though medical tests show that they are healthy. Sometimes it goes to an extent where a person is convinced that he has a terminal illness, maybe cancer or maybe something like that. Even when the doctors reassure him, he is not convinced. He will seek second opinion, if needed, a third opinion, and so on and so forth because he is convinced of the terminal illness, even though tests and doctors and medical opinion confirm to him that he is healthy. People with hypochondria are not making it up. It's not like they are faking it. Their fear is very real and causes them a lot of distress. What happens is that the mind interprets very normal body sensations like a heartbeat, a muscle twitch, or some mild headache as signs of a serious disease. For example, imagine you feel a small flutter in your chest after climbing stairs. A normal person will think, okay, I'm out of breath because I just went through some exercise. But someone with hypochondria might think, that's it, I have a heart problem, I'm going into a heart attack. They may then read online about heart attacks, feel even more anxious, notice more sensations, and get stuck in a loop. Fear leads to body tension, which leads to more sensations and more fear. The body and mind start feeding each other in a cycle of anxiety. For someone who goes through hypochondria, it is a very traumatic experience. People with hypochondria often check their body repeatedly, feeling their pulse, checking their skin, looking at their tongue, or measuring BP. They search for symptoms online, which increases their anxiety. They visit multiple doctors for reassurance. They doubt the doctor's reassurance as well. Maybe they missed something, or maybe the tests were not as accurate. They feel better for a short time after hearing they are fine, but soon worry again about a new symptom. It's not attention seeking, it is a genuine fear of illness that feels uncontrollable. But why does it happen? There is no single cause, but a few common threads are: the first one is health anxiety and personality. Some people are naturally more sensitive to physical sensations and worry easily about them. There could be past experiences. Having seen a loved one suffer or die from a serious illness can make a person hyper alert to any sign of sickness. It could be information overload. The internet is both a blessing and a curse. Googling mild symptoms can convince someone that they have a rare disease. There could be stress and emotional factors. Sometimes the mind converts emotional stress into physical sensations, a process called somatization. Even when it comes to personality, there are people who are deep thinkers. They contemplate over existential questions like meaning of life, death, origin of the universe. For such existentialist thinkers, many a times they go through this hypochondriasis. Let's understand this through a simple real life analogy. Think of the body like a car dashboard. When you are calm, you notice only the big warning lights. But when you are anxious, you start staring at every flicker. Is that a new light? Is something wrong? Hypochondria is like constantly watching your dashboard for danger, even when the engine is running perfectly fine. But how is it different from being careful about health? Being health conscious means you take care of yourself, you get regular checkups, and act when you notice something real. But being hypochondrial means you feel a sense of constant dread about illness, even when you are told that you are healthy. The difference is in intensity, frequency, and distress. Hypochondria steals your peace of mind and makes your life a living hell. Can it be treated? Definitely. It is treatable, and many people recover very well. Cognitive behavioral therapy is very effective. It helps you recognize unhelpful thoughts. For example, when your mind throws a thought that the headache could be a tumor, you replace it with more realistic and rational one. Like headaches are common and often harmless. CBT and even therapies like REBT teach how to stop body checking and reassurance seeking habits. Mindfulness and relaxation is useful. Learning to observe sensations without judgment, noticing a feeling without jumping to conclusions. Medication is also useful if the anxiety is severe. Sometimes antidepressants, like selective serotonin reuptake inhibitors, are used to reduce the underlying anxiety. And most important is education and support. Understanding that the problem is anxiety and not a disease can itself bring huge relief. Support groups or therapy help share experiences with others who understand. Hypochondria, an illness of fear of illness. It is not faking, it is the mind's overprotective way of saying, I don't want you to get sick. But sometimes that protection goes overboard and becomes the way or the very thing that causes suffering. But with the right help, therapy, mindfulness, and sometimes medication, people can retrain their minds to trust their bodies again and live peacefully without constantly searching for illness. Thank you so much for listening.